Good. Okay. All right, we are live. Good evening and welcome to the Policy Subcommittee of the Brockton School Committee for Wednesday, October 28th. This evening, we do have quite a few items on our agenda. First, we'll start with a review of current COVID-19 metrics. We'll have our ongoing discussion on remote and hybrid learning model, special education and high-need students return. We'll discuss the automatic failure, attendance for extracurricular activities or citizenship grade, and then we'll be talking about student laptop cameras, and we will conclude with any other business that needs to come before policy. So I believe we have Mayor, did you want to?
Yeah, Mr. Vice Chairman, if I could, I want to thank you and the members of the committee. We do have Dr. Rick Herman, MD, here again tonight. And before he goes into the metrics and does a deep dive in the statistics and the data, I just want to say how fortunate we are to have Dr. Herman helping the city, to the extent that he has done such a deep dive that the Commonwealth of Massachusetts, on a call yesterday to every municipality's Board of Health, specifically called out Dr. Herman and said that he has really been a catalyst for the deep dive throughout the Commonwealth, and now they're using his template throughout the state. So I just wanted to publicly let people know that we definitely have the right person helping us right now, and I'm just very thankful that Dr. Herman is working as long and as hard and as tirelessly as he does. So thank you, Mr. Chairman, and thank you, Dr. Herman.
I wanted to give the presentation without the mask, so is it okay if I stand up here and do it? And thank you for that introduction. I don't think it was quite that enormous a praise that I got. I think I wrote one good program and they liked it.
It was.
Okay, so back for another round. Thank you very much for having me. I appreciate the invitation. So once again, we'll start nationally and come down to Brockton. This is the CDC's numbers from 12:30 this afternoon, which reflects up to yesterday's numbers. A little bit frightening because we are now at an average number, rolling average, 7-day rolling average of greater than 70,000 folks, which is even higher than the summer peak, which is alarming on a national level. In Massachusetts, and this is the CDC's numbers for Massachusetts, from March 14th, our first case, until yesterday, I again highlighted the kind of 4 patients per day per 100,000. So this is cases per day per 100,000. The red, yellow, green number that the state uses and the Board of Education, the Department of Education uses. So you can see that over the past several weeks, not only have we crawled up over the 4, but we crawled up over the 8, and now we're close to 14 on a statewide level. Tomorrow, when the number is released, it'll probably be less than that because this uses a 7-day rolling average and the state uses a 14-day rolling average. But the more accurate 7-day average looks like statewide the number is about 14. Once again, I've showed this before. This is the heat map of the Commonwealth. The deep dark blue shows everyone with every city with a rate per 10,000 people greater than 350, and I'll do the math for you. That means that more than 3.5% of the population is infected, and in fact, Brockton is one of 6 communities in Massachusetts that has more than 5% of its population affected. And here they are. This is the top 10. So Chelsea and Lawrence are the big 1-2, and then Brockton is kind of in a 4-way tie for third in the low 5% of their population. And in the red column, that's last week's red, yellow, green number, showing that Brockton, which was at 14.7, has a lot of company in the red. In fact, all of the high-ranking COVID communities are in the red at this point, along with 77 other communities in Massachusetts that are currently in the red. So quite a different picture than when I was here last time several weeks ago. So what I wanted to do is show the map. This is the map that a state epidemiologist prepares every week, just to kind of show the red, yellow, green status. So this is the very first time I came here, which was back in August, which is when they first started making these maps. So if we run through from the beginning of August, and we just look at the colors and see that kind of by the middle of September, the map's starting to get a little bit yellower. And here we are kind of in the beginning of October getting redder until last week when it's getting really reddish. So this is today's dashboard, and instead of the usual graph that I put in the center showing a number of cases per day or whatnot, I wanted to make this dashboard as red as I possibly could because the numbers are really going up quickly, both in Brockton, around the state, around the country. So 7 new cases today, which is quite honestly the lowest number we've had in a long time. 2 new deaths today, bringing us up to 303. And the number that I'm a little bit concerned about is the hospitalization number. So for the past many months, our hospitalization number, and this is the number combined in the 2 hospitals in Brockton, has kind of been in the teens, 10, 15 patients combined in the 2 hospitals with COVID. But now we're up, yesterday jumped up to 29 patients, still at 27 patients. Now, I don't know if this is just a one-off and is going to be going down again, or if it is a warning of things worse to come. And we certainly are on the phone. When I say we, I mean the mayor and myself are on the phone twice a week with leadership of both hospitals and are going to keep a very close eye on this because this is kind of the warning sign of things getting bad. We don't want to get to a point where our hospitals reach their capacity, have to use surge capacity, and don't have room to take care of sick people who need the help. And again, you see last week our number was 14.7, but as I've mentioned in the past, that's ancient history. That is a number that was put out last Thursday. And by the way, the number, the release date has changed now. So instead of every Wednesday at 6 p.m., it's now Thursday at 6 p.m. So I can't give you the number from 6 p.m. tonight because it's coming out tomorrow. They changed that to give more time for the test results to come back. So when it comes out tomorrow, Thursday, it will reflect a 2-week period leading up to last Saturday. But we don't need that. We can look in the blue box down in the corner there underneath the BR in Brockton and see that we're at 20 now. That's looking 5 days ago and the 2 weeks leading up to 5 days ago. So if you want to do the math and know what the number is going to be tomorrow, so tomorrow on October 29th, Thursday, they will look at this 2-week period between October 11th and October 24th. And they'll measure it, and it'll be 20.2. Now, I don't say this with 100% predictive value because cases may roll in between now and tomorrow when they push the button, cases that are positive from last Saturday or Friday, that kind of thing. But it'll be around 20 or greater, is my guess, when the number comes out tomorrow. And so this is what our track record now looks like. So this is what the number has been, including tomorrow's number, every week for the past several months. And from the time we were at the end of July when we were in the low 4s. And obviously you can see not heading in a good direction. Does not take an epidemiologist to see which direction we're heading in right now. And just to kind of give you the ancient history, this is from the beginning, first positive test on March 14th up until a couple of days ago. And don't get encouraged by that last little blip of downward trend at the end. That just means the tests haven't come back yet. So these are based on when a swab was taken, when it's called the specimen date, when the specimen was actually obtained. And it might be 2, 3, 4, 5 days before those results come rolling in. Once again, up to 5,268 cases as of about an hour ago. 303 deaths, 2 more reported today in elderly people in the city of Brockton. And then this is the testing data. So the testing data lags a little bit. You can see that week starting October 18th, this is from the state, only a handful of tests are back yet. There's a lag in reporting it to us. So the more accurate number is that week starting October 11th, when we're at 8%. We're also 8% in the week starting October 18th. But I feel like we get a more accurate picture from Brockton Neighborhood Health Center, which is able to give us the numbers more quickly. This represents their testing up until a couple of days ago, so the 19th to the 25th, I believe. And they just shared this data with me this afternoon around noontime, so it's up to date. So our last week of testing is 11%. So what does that mean, 11%? I don't use the testing percentage as a valid indicator of the severity of illness. I like the number of cases per 100,000 per day, because that tells us how many we actually have, as opposed to the percentage, because the denominator can change week to week, how many tests you actually do, and a lot of those are asymptomatic cases. A lot of those are just getting tested for employment or school or that kind of thing. But some areas do use a 5% threshold, like New York City would say 5% threshold. Anything greater than 5%, we wouldn't want to open the schools. Some states, like particularly in the South, where there's not a high belief in things like science, would use a number of 15% to open their schools, and say anything under 15%, you can't close your school. And this is the hospitalization number. Again, this is something that I'm particularly concerned about. So just the last couple of days, we have a blip up. And you can see, if you look kind of in the middle of August and at the end of June, we also had a blip up, but it came right back down. So I don't know if this is going to be a blip up that comes right back down, or if it's going to continue to go up. The feeling, just the general sense right now, is that we are so surrounded by so much COVID in so many communities around us and so many other geographic areas in the country, is that this could be the start of something real. So we do want to keep a very close eye on it. Once again, just to refresh your memory, average cases, this is all comers over all time. City of Brockton, 46 years old is the average case of a COVID patient in Brockton. 70 years old is the average case of a hospitalized patient in Brockton. And 79 years old is the average age of a patient who's died. And this is kind of the spread of all cases over all time, the greater than 5,000 cases. And shows you kind of by decade of life what age group they're in. So 0 to 10, only 2%, 10 to 20, only 5%, and so on. A little bit different look to the graph of people that have died, and this is by decade of life, with the exception of that first 0 that represents the first 3 decades. So age 0 to 30, there have been no deaths in the city of Brockton, just 1 in the 30 to 40 age group, and so on. So you can see 70, 80, 9-year-olds, 90-year-olds particularly at risk. And this is a slide I like to show, not because it has any demographic value whatsoever. It cannot be used for planning, but it does show that more people over age 100 in the city of Brockton have died than younger than age 50. So clearly a disease that takes its toll on the elderly and not on the young. So only 3 people under age 50 in the city of Brockton have died. So this is going back to my first visit here. This is what the demographic variation was back in August. And this is what the state looked like over the last 2 weeks. So this is across the state. This is not Brockton. This is across the state. The average age group, the beginning of the pandemic and well into phase 2 and phase 3 was across the board, all decades of life affected, with the exception of school-age kids. In the last 2 weeks, and even before that, as we've talked about in previous meetings, the demographic has really shifted, but now remarkably so, such that the highest demographic now is school-age kids, 0 to 19 years old. followed by the 20 to 29-year-olds. So a total shift to the left in the demographic variation of COVID. So if we compare that to what does that look like in Brockton over the last 2 weeks, or at least the last 2 weeks of data that we have, it's identical. So in Brockton, of course the numbers are so much different. You know, on the left it's a scale of 2,000, on the right it's a scale of 50, but still, statistically, it's the same. In Brockton, as it is, it mirrors what it is in the state. It's younger people that are getting COVID way out of proportion to the older age group. So where are these cases coming from is the $64,000 question. And it's one that we struggle with and, to be honest, don't have a good answer, but are trying hard to find out. So how do we try and find out? The answer is in the contact tracing. It's not just, oh, I saw a big house party, or I walked down the street and somebody wasn't wearing a mask, or I know my cousin's niece had a birthday party. Sure, those all happen, but it's not data. And so we're trying to get the data. So every week, every Thursday, we talk to the CTC, the Community Tracing Collaborative, and their epidemiologic investigation unit, who they've assigned to the city of Brockton, and they break it down for us as to where the cases are coming from. And it gets broken down a little bit even more granular than this, so we know what warehouse is involved, what church is involved, what hospital or healthcare facility is involved. And the bottom line is that we still don't have a specific place that we can pinpoint. So many people do not talk to us. They won't answer their phone, they won't call us back, they refuse to give us answers even when we do get in touch with them. Many of these cases are in individual households, onesies and twosies in individual households. A few are in these close contact events. So these are the house parties and events that have more than one sort of source. And you can see that there are clusters, which the state has a definition for, but it's basically more than a few cases from one individual place. And so we're really trying every week to get a handle on where the cases are coming from. But from my perspective, they're coming from everywhere. They're coming from the fact that everyone has become a bit more complacent, and it's generally people that know people. So it's just hanging out with your buddies at the restaurant who are asymptomatic, because probably about 50% is my best estimate. 40 to 50%, some say higher, but about 50% of the spread of this virus is from asymptomatic people. So all of us here sitting in this room, unless you've had COVID before, could have COVID. We just don't know about it. Maybe tomorrow we'll get sick, or the day after tomorrow we'll get sick. But we could all be infectious and infecting each other if we get close enough and stay indoors, close contact for a prolonged period of time. And so most of this is people who know people, household events, relatives, families, small get-togethers, that kind of thing. So I read in the Brockton Enterprise that I was invited here to give a deeper dive, and so that's what I will do. So this is the bubble map of the city of Brockton. You've seen this before. The bigger the bubble, the more cases. But of course, we are interested in the kids in Brockton. And so I had been asked on a previous trip here, where do the kids live? This is where they live. So this is the 302, it might only be high 280 something, that Jen Putz from the Academic Public Health Volunteer Corps put together for us, a geomapping of the school-age kids in Brockton. And forgive me that it's so generic, the locations of the schools, you all know which they are. But the bigger the bubble, the higher the number of cases. You can see that we have a couple of places where there's 5 kids at one address in the city. So it would be nice if if it were geographically mapped out according to school and there wasn't choice, but this is where the kids are. And this is the number that we're at as of now, as of the last case. So 302 kids in the city of Brockton, and this is 0 to 18 years, and meaning less than 18 years. And the way MAVEN, the Massachusetts epidemiologic network, lists ages is in decimals. So this is 0 to 17.99. Everybody less than 18 years old, there's 302 cases. Of those, 5 were hospitalized. Nobody made it to the ICU. Nobody died. And in addition, I know that we do have some older kids in the system, and so the 18s and 19-year-olds, there's 93 of those, and the 20 and 21-year-olds, there's 145 of those. Our first case was swabbed on March 26th. Our most recent case was a couple days ago on October 26th. And just looking at that, the most recent 2-week period, 1-week period last week, the 18th through the 24th, there were 33 cases. And I'll show you this map, which I like, and I'll tell you why. This is, I just went back and really hand counted by week each of the weeks from the beginning of the pandemic and how many cases there were in that week. And I put the gray line on 5. And the reason I did that is because if we have 5 cases a week, that means that you're having a case a day in your school system, right? So five school days. So it's a case a day in your school system. So the dotted line is a rolling average. It's a 2-week trend. So it's a kind of a rolling average. Anything above that gray line means you've had 1 case a day in the entire school. Anything above 10 is 2 cases a day. Last week, we're up above 25. That's 5 cases a day. And in fact, we did have 33 cases in that 1 week. I know this graph stopped at 30, and my algebra teacher would have killed me because I didn't put the graph, the axis correctly. But anyway, it should go up to 35 because that last bar on the 18th is 33 cases that we had last week. Totally even split. That never happens, but exactly split down the middle, 50% boys, 50% girls. And this is just the raw numbers. So this is how it breaks down in 2-year groupings. So 2-year groupings by age of all the kids up through age 21. So the 20-year-olds and the 21-year-olds. And to make it a little bit more appropriate for school-age kids, this is kind of the age group just up until 17.9, so anything less than 18. And when I talked to the superintendent, he thought it would be a good idea to group it by school age. So this is the grouping by school age kids. So preschool or pre-K, grade school, middle school, high school. So we've had 107 high school age kids in the city of Brockton over the course of the pandemic. This doesn't mean they all went to Brockton High. Doesn't even mean that they went to high school in Brockton. Maybe they went out of the city for some reason. But that's the ballpark, just so you have a general idea of how many kids and what age group they were. Now, Linda Cahill was able to help me out a bit, because the one thing we don't gather, and certainly haven't gathered from this beginning of time, meaning March, is what school do these kids go to? And so she painstakingly went through at least 239 and was able to get data out of 184. So this is this isn't a complete 302 kids, but it kind of breaks down what schools these kids go to. And the onesies and twosies, the way the state does it, they'll list less than 5 because they don't want to make anybody identifiable. So anywhere there was a 1 or a 2 or a 3, I put less than 3. So that could represent 1, 2, or 3 on those numbers. But this is the breakdown of where the kids are in the elementary schools and the middle schools. And obviously, I will share this with you superintendents, so you'll have all of this data available. I can peruse it and look at it a little bit more carefully. So of those 100 and some odd age high school kids, we were able to identify 74 at Brockton High. But remember, this is only looking at 230 out of the 302 cases. And this is the remainder of the high schools. So I think we've done a pretty good job of gathering some of the data regarding age, gender, location. What about the other questions I get asked? What is the ethnicity of these kids? What is their race? These are the questions that Maven asks, and these are theoretically data points that we should be obtaining by contact tracing everybody who tests positive for COVID. We do not do a good job. We do not do a good job. So of the 300 kids that I looked at, in the column for ethnicity, there is an answer in 27 out of the 300 kids. That's not good. That's not going to tell me. Even if I told you what that breakdown was, it doesn't. It's 10% of the kids. By race, we're missing 22%, and unknown was 9%. But this is the breakdown based on the data that we do have of the 80% that we do know, and how the child or his or her parent identified race. And then the question is also asked, Hispanic, yes or no? And then these are the answers that were obtained. I also got asked a question, what kind of symptoms do these kids have? And in general, I can tell you that they parallel adult symptoms. They tend to be more like the mild cough and cold kind of symptoms, congestion, cough, fever. But on Maven, the epidemiologic network, you get to ask the question, every single symptom, sore throat, yes or no, shortness of breath, cough, headache, aches and pains, vomiting, diarrhea, every symptom you get to ask, 70% of that data is missing. And so we need to do a better job on our end of the people that are doing the contact tracing and asking the questions of filling in that data if we want to get anything out of it, if we feel that it's important to have. So just to sum up, this is our history of COVID in Brockton. The number 4 line and the number 8 line, which seems so long ago in our rearview mirror when we were actually flirting with numbers between 4 and 8, are there. And this is the direction that we're heading. And as I mentioned last time, I think we're in it for the long haul. And so even though we are now in October of 2020, we still got to get through this winter with the flu and COVID existing simultaneously without a treatment, a cure, or a vaccine. We have to get through next year when treatments will be introduced and vaccines will be introduced to at least some of the population. We'll have to make it through the first half of next school year and another flu season before the population is fully immunized, if it works, and come around and hopefully by spring of 2022 can see some success and look at this thing as something that happened in the past. So just a thank you. Scott Tropy is the state epidemiologist who put together those geomaps for me. Linda went through a deep dive in the school system. Kathy Youngman at Neighborhood Health Center shared her testing data. Dr. Jennifer Putz at Tufts was from the Volunteer Corps Public Health and did the data mapping for the kids in the map. And Taylor is from the Epidemiologic Investigation Unit that did the contact tracing. So that's what I got. I'll be happy to answer any questions.
All right, well, thank you for that presentation, for the information. Mayor.
Thank you, Mr. Chairman, and I think that speaks to Rick's deep dive. I mean, that information is extremely valuable. A couple pieces of information. We decided to do it on a Wednesday night because we thought we'd have the hard number. The state changed it last week, so they're doing it, as Doctor said, on Thursdays. Rick and I had it was either 12 or 15 pastor call today to the pastors and clergy to try to reach out to them as well. We have a standing call every week, but more pastors joined today because they sense the urgency. We had a meeting last Friday at St. Edith's Town with Father Michael, Counselor at Large, former Mayor Moses Rodriguez, and a lot of clergy in the Cape Verdean community. And one thing that Dr. Herman didn't share today, but he shared it then and he shared it on a call today, is that the hard number was 40% of Cape Verdean ethnicity of the total number.
Yeah, so we did have a Cape. So this is not a scientific study. This is a nurse, a Cape Verdean nurse who went through a sampling of it was every 50 patients, so 100 patients out of the 5,000, and felt that there were about 40% of the positive cases were of Cape Verdean heritage. Probably about 20% of the population is Cape Verdean, but about 40%. So we did have a meeting with the Cape Verdean clergy. I went on a Cape Verdean television, cable TV on Friday. My thought here is that I am not effective, okay? And when I say I mean doctors in general are not effective because we've done our thing. Wear a mask, wash your hands, don't go near other human beings, okay? We all know how to stop COVID. That's what you got to do, okay? But people are not doing that, okay? So people are not doing that. So how do you motivate people to do that? And the answer is find motivators. Now, I don't know who motivates everybody in the, who's still going to have a 20-person Thanksgiving and is still going to go to the 7-year-old birthday party. I don't know who does that. But one thing I found is that clergy seem to have a pretty good relationship with their congregations. And if we can get the clergy to spread the word, then maybe people will trust them. The other thing I think would be enormously helpful is kids. I think if there was a strong curriculum, COVID curriculum in the school system so that 7-year-olds would tell their mommy and daddy, I really don't want to go to that birthday party. In school, I learned that it's not good to go to a birthday party because I could bring it home to grandma and grandpa. Or if they can tell their parents, hey, I learned in school that we shouldn't have a big Thanksgiving dinner because grandma's going to be there and she's at high risk. The older people are at high risk. So whatever level it's going to be, whether it's taking second graders or 11th graders, if they can be the motivators, because a lot of parents are motivated by their kids and they'll change their behaviors based on what their kids do, but it's got to be somebody other than me, because I can't say, wash your hands, wear a mask any more than I'm saying it. And still, the numbers are heading north. But anyway, so, the clergy is one group that I feel might be helpful to do that, and kids, I think, would be another group that would be helpful.
Mr. Vice Chairman, just to kind of piggyback on that, when Dr. Herman mentioned that to me this morning, I said, let's talk about it tonight before the school committee. Think about it. It's a captured audience every day, right? The dedicated teachers, right? The men and women that are teaching our kids have a captured audience, the boys and girls. It's best practices. It makes sense. And when Rick said it, I said, I support that 1,000%. I can't speak for everybody here, but listen, more information is going to help our community and save lives. When John McGarry was head of the Board of Health, John said to me he thought maybe 30 people would pass away because of this. We're at 303 right now. So we need to somehow minimize and mitigate, so it's all hands on deck. Whatever we can do, we need to do. And I just want to thank you again, Rick. That was hours of research right there. So thank you, and Linda Cahill and everybody else. Thank you, Mr. Vice Chairman.
Yeah, I want to thank Dr. Herman again for and everybody who helped you with the time that went into this. This was obviously a lot of work, I'm sure, and very in-depth, and I really, really appreciate it. This is certainly the deep dive that we asked for and we're looking for. Did you want to?
I just wanted to add that I did speak with Linda Cahill about what's going on in the school system now, and she referred me to, and I'll muck up Dennis's name.
Genich.
Genich. So, and he did reply and tell me kind of all of the things that are part of the current health curriculum in the school, but even still, sort of a daily update for kids. So, I mean, listen, I remember, Mr. Ty's 8th grade social studies class, at King Philip Junior High School when Kennedy was shot. I remember exactly where I was because that was the defining moment of my childhood. And I'm old, as you can tell. But, for these kids, they don't remember 9/11. This is the defining moment. This is what has disrupted their childhood. And I think that it's going to be very memorable, and the more they can learn about it at whatever level, so if it's second graders learning, I need to wear a mask, I need to protect grandma, or if it's high school seniors learning about, the spike protein on a virus and the acetylcholinesterase receptor and messenger RNA, whatever it's going to be, whatever level they can understand, the more the merrier, because it's going to help them behave in the appropriate way.
Thank you. Does any member of the committee want to have any questions or comment?
I want to say,
Doctor?
Doctor, thank you for doing this. It's very important for us to, again, dive deep into the numbers, which the Department of Ed is asking us to do, in the numbers of school-age children that the uptick in how many of them have been affected is alarming. And we're not in school; we're remote.
I was going to say
And
that.
seeing that number go up with students not being in school, is alarming and concerning. But thank you for reaching out when you were putting all this together and asking questions of information we need. And we had a call. Superintendents had a call on Monday with Commissioner Riley, and there was an article in the Enterprise that the state is still pushing for schools to be in person and stay in person, even with the numbers going up. But his message was clear. But if you are going to stay remote, to make sure that you're getting numbers like this to look at where the age groups are, and and that's what we're doing. And again, it's still alarming to see the number of school age kids that have this when we are not even in school. So it's important to note
302
that.
kids, and they're not in school. Imagine, obviously we're assuming, but I think it's a safe assumption that it would be substantially higher if we have 16,000 kids, in our school buildings. I think it's a safe assumption that 302 would be a much scarier number. And I know the state's pushing that, but
No, and again, they ask you to, make decisions based on the numbers, and that's what this committee has done.
Yeah, absolutely. And other districts, from my understanding, other urban districts are following suit and going remote as well, as they see these numbers.
Well, and I think it's a little bit. I think it's a little tough because they sort of set the standard. They said over 8, shut it down.
Right.
That's what they said. I don't know where they got that number. It is not a national standard. It's not something the CDC uses. I don't know in the literature where it comes from, but that's what they said. And I think it was to make it pretty easy for folks to make their decisions, especially if they don't have a whole lot of medical input and epidemiological input. So it's tough to walk it back once you said that. And this is kind of happening all through the pandemic, right? In the hospitals, when I first started working, it's wear an N95 mask and change it every day. And somehow that boiled down to, put on a bandana and make it last a week. And so when you set the standard high and then try and lower the standard, it's a tough sell to folks. What was magical about that 8 number? I don't know. But now you're telling people, but you told me 8, why are you telling me it's okay now that you're at 14, that it's okay to open the schools? Or tomorrow, when it's going to be 20, you should send the kids to school. So I do think it is challenging for folks to have to explain that and feel that it's a safe environment to work in or study in.
Yeah. No, you're absolutely right. How do we, like you said, walk that back now that we've blown that number away, and then to try and walk that back and say, yeah, but it's safe. Anyway, any other, Mr. Sullivan?
Yes, Dr. Herman, thank you for the presentation. It's excellent, as usual. I was just wondering if a person lives in Stoughton and comes to Brockton High School for the COVID testing, does that get counted in Brockton, or is it counted as Stoughton?
No, it's all of the numbers are based on your city of residence. So if you live in Brockton, that is the number that's up there. If you work somewhere else, if you work in Brockton, you get tested here and then go back home to Randolph, you're counted on Randolph. So it's only people that have a residence in Brockton. And in fact, the local boards of health can only see residents in their town. I can't see a test from Brockton or from any other, from Randolph or any other town. I can only look at the data from people that live in the city of Brockton.
I was just wondering, Doctor, in the town of Avon, there's no hospital, so they have to come to Brockton. Do they get counted as Brockton people?
If they live in Avon and get tested at the hospital, or they get tested at Brockton High School, or they get tested in Massasoit, wherever they come to Brockton or anything, if it's a positive test, it's assigned to Avon, if that's where they live.
Okay, thank you. That's good to know. Thank you.
Thank you for the presentation. Just had a couple of questions. So, I'm noticing a lot of families are actually reaching out nowadays, asking where to go get tested. So a lot of people are stepping up and getting tested, and as we can see, they're probably bringing their children. How often within a month are you allowed to get tested free of charge?
As far as I know, no one's asking.
Okay. That was actually a question that was brought up. They're like, okay, if we get tested, we're in a visible position, within the public. They were curious, is there a limit where there is no charge? They weren't sure if, they're going to tell them, no, you've met your quota for the month.
As far as I know, they're not asking, have you already been tested?
Okay.
So I don't want to encourage people to get tested every day, but I'm not aware of any limit that, at least that hasn't been brought up to me. It hasn't come up in any conversation.
Okay, no, definitely, because I know a lot of people just run and get tested right away. And I tell them, I'm like, you just, quarantine yourself, give it some time, because it does take time to get into your system between 3 to 5.2 days. So you don't want to fall negative. So it's better to give it some time. So that's why I was just curious if they could, get tested 2 weeks in a row, just in case they did get tested early on and it was a negative, but they still had these symptoms come on.
Right. So remember, if you've been exposed, if you've had a known close contact to someone with COVID, then you're in quarantine for 14 days, okay, regardless of what your test shows. If you test negative on day 2, 3, 4, 11, 12, you are in quarantine for 14 days, whether you're a school kid or the Vice President of the United States. If you had a close contact, you are in quarantine for 14 days. That's the rule.
Thank you for clarifying that. Thank you.
Any other members of the committee? Mr. Minicello?
Doctor, once again, thank you very much for your data. Obviously those numbers are concerning to us, and certainly as school committee members and members of the community. If in fact a decision was made to bring students back within a 2-week period or 3-week period, what would your logical assumption be with regard to the 20% or the numbers, your prediction be basically?
So as far as that number 20, so don't forget it, that's 20, it's not 20%, it's 20 cases per day per 100,000. I think the number's going up anyway. But obviously if you bring in people where we now have that high penetration in a community and put them indoors in close contact with one another, whether it's on school buses or in classrooms, I think the logical assumption is that the number would get higher. I don't know how much higher, and I don't know how well people are going to be following the rules and how well people are going to be spaced and how good the ventilation is within a given classroom. But clearly it was never anyone's intent to have 20 new cases a day per 100,000 and bring schools back in session. It was 8 was going to be the limit. So this is, right now we want to be doing behaviors that reverse the upward slope. So whatever we can do to stop the congregation of people, spreading the virus. So those are the actions that we want to take, not actions that are going to bring people closer together.
Thank you very much.
I was curious, kind of piggybacking off of Ms. Asak's question. I know I've heard a lot of, if you watch the news and what have you, one of the things they talk about is more testing is key to this, right? And so then I'm wondering, like, should you only get tested if you have a reason to think you've been exposed or symptoms, or should anybody who wants to and can get tested with certain regularity or frequency as a matter of precaution, just your thought on that.
Well, there's a couple of schools of thought on that. I think that if you have symptoms, you should get tested. If you think you've been exposed, you should get tested. And then if your level of concern and anxiety or just concern, if you want to know, then get tested. Some places of employment require regular testing. I'm a college physician. I get tested every week. They won't let me on campus if I don't get tested. And so it's not a hard and fast rule, but if you have testing, you have to make sure that you have the contact tracing to go along with it. And my fear is that we're getting to a point where there's so many positives that are showing up that it's tough to do the contact tracing. 'Cause when I go in and look at the list every morning and I see that there's 30 names now added to this list, who is going to be calling these 30 people within the next hour? Because if I test positive at 9 in the morning, I want somebody to be calling me at 10 in the morning to say, who are your close contacts? But, this could go on for a day or two before you get contacted by a contact tracer. Hopefully it's not that way, but it could be that way.
Right. Yeah, I mean, and the other thing that came to mind while I was listening to you is obviously, and I think, Mr. Minicelli, you were kind of asking along this line too, if we had kids in schools, not only do you risk the numbers going up with school-age kids, because again, we have 302 with no kids in schools, but also I would assume that the potential to increase transmission all over the city as kids, we don't even have neighborhood schools. We have kids going into schools outside of their neighborhoods and various parts of the city. So I would imagine even if the kids were asymptomatic, they have the ability to transfer this all around too.
Sure, and of course, the concern, of course, we have concern for the kids, but the data sort of tells us the kids are not getting that sick. The kids are not being hospitalized. The kids are not going into the ICU, and the kids certainly are not dying. They get a bad cold. So it's not the kids so much from a burden of illness point of view. It's their parents and their grandparents and the rest of us in the community that are at risk for getting the disease, especially those that are in higher risk groups. So if a kid lives in a multi-generational household with older people or people with underlying conditions and then brings it home, that's the risk
Right.
in opening up the schools.
Right.
So, I was hoping that it's, by this point in the pandemic, I was hoping that we would have at home, do it yourself, spit in a cup antigen testing so that you can wake up in the morning, brush your teeth, do your COVID test, take a shower, go to school. But we're not there yet. And hopefully we will. Hopefully on the other side of flu season we'll get there. But, that might be a solution if there's a cheap buck-a-day test that you can do that before a kid goes to school, he takes his COVID test. And
Right.
we may never get there. It may be that the penetration of the vaccine gets approved first and is widely accepted, and that happens before the testing gets rolled out. But I was hoping that would have been how this all played out.
Okay. Anyone else? Yeah.
Mr. Chair, I just want to kind of piggyback. So we're dealing with COVID-19 and we're dealing with the flu season, and I want to thank the superintendent and Brockton Public Schools. I took my youngest son to the drive up here just the other night. It's a collaboration with CVS, and it's brilliant, and it's being proactive. And Linda Cahill sent an email out now that it's even opened up now to city employees. Before it was Brockton Public Schools students and their siblings 3 and older. It's a win-win. We don't want to be fighting a massive flu epidemic and a pandemic at the same time. So, Superintendent, I want to thank you and all your leadership, and I want to thank those at CVS that entered into that partnership, because it's going to make a difference.
Yeah.
Thank you.
I want to thank Dr. Cobbs, Tobias Collins, and Linda Cahill. They did a lot of work to get that met the people from CVS, the tent company, put everything in place to make sure the traffic flow works, and along with school police. So they did a great job getting it set up.
Thank you, Doctor.
All right, if there's nothing else for the doctor and on this agenda item, we can move on to item number 2, which kind of ties into item number 1. Basically is the remote hybrid learning model discussion. I don't know if you want to.
Yeah, it's just, I wanted to just give you an update. Again, we keep moving forward. As every day we do this, teachers are doing a great job. Again, this is not how we want to educate students, especially our students with disabilities and our youngest learners, pre-K to 3. It's really difficult educating students this way. But again, our teachers are doing a tremendous job. We do have every student now with either a brand new laptop or a laptop that's only a year old. We have, swapped out the old blue laptops. They are used for backup in extreme circumstances. We're in the process now of trading out all the teacher laptops to new models as well. That should be done, I believe, by next week. So again, and teachers continue to work hard to work with, beyond issues with Zoom, as you're always going to have Microsoft Teams, Schoology, which is our learning management system. And again, every day you don't know. It could be a platform that's down, and then the teacher has to pivot and either go to Zoom or use Teams. And, that kind of thing is going to continue with, pretty much the entire country using distance learning, whether you're hybrid or fully remote. It's still, millions of kids on computers. So again, they're doing a great job. The hybrid model, when we're able to switch that, will be tricky. There's a lot of planning that goes into it. It's a lot more work for teachers because you're planning pretty much 2 lesson plans for different students. We're still, working with the BEA, still working through. We'll have a team back working on the hybrid model. It will be a lot to figure out for transportation to make sure we transport students safely. But that's pretty much our update. Again, the engagement has been really good, and the teachers and the administrators have really worked hard, along with the counselors, to really get students engaged who are, that we find we have some issues with lack of engagement. But they've worked hard to go beyond that, and we're, again, still at about 93 to 95% of students attending, and we'll continue to, work hard to identify the ones that are not and get them the resources they need. But again, I'm never going to minimize how difficult it is, how hard the teachers are working, and again, this is not the way we want to educate kids, and it is very difficult for our youngest learners and our students with disabilities. There's just no way around that.
Okay. Yeah, I mean, I again agree with everything you said. I mean, the teachers are doing an amazing job. It's a tough way to teach it, and I know I'm not the only one on the committee that's seeing that, firsthand with, their child or children's classes. And I have to say, my son's teacher, Mrs. Seavey, is doing a great job, and what a tough way to have to try and teach, and a tough way to have to learn. So the kids are doing a great job, and the parents trying to, or caretakers or whoever's involved in trying to help the kids stay on track. I mean, everybody who's involved is really putting up their A game and doing their best and doing a great job with this. So, and we just have to.
Yeah, and like you said, piggyback. And again, I neglected to mention the parents, how hard they're working, and it's not easy on parents with the daycare situation. It's and we can't forget that, the struggle with the daycare, parents working, especially for younger children that obviously need somebody home with them, and how difficult it's been for them as well.
Yeah. Any comment, question from the committee? Ms. Zasak, did you?
No, I can.
Okay. I thought you
Might
were
be a
waiting.
little off topic, but I just want to really commend the parents, and especially our teachers and the students. Today I was able to observe a couple of parents had posted children wearing, like, the teachers are trying to make this fun and educational, and just seeing them wearing their costumes and trying to interact and trying to do keep them entertained, and focusing on their schoolwork. So, again, we're seeing, our teachers are really thinking outside of the box on some of the stuff that they're doing to keep our students engaged. So, I mean, it's not going unnoticed. We're noticing everything, but we got to keep everybody safe. So, we just appreciate everybody working with us. But no, that was it. Thank you.
All right. Any other members of the committee want to weigh in or have any questions on this particular item? All right. Seeing none, we can move on to the next item on the agenda, special education and high needs student return.
Yeah, so we have Sharon Wolder is with us, Chief of Student Support Services, and our Director of Special Education, Laurie Mason, to give us an update on how remote learning is going for our students with disabilities. And pretty much, and Laurie will also give you a little bit of an update on, when we're able to return to in-person, the things that she's been working on with her team. Well, yeah, do you want to go? Is there a microphone? You got it, okay, good.
I'll just hold it, because, can you hear me? Is that, everyone hear me? The teachers are working hard. We're providing the students with, obviously, with as many online platforms as we can. We're doing a lot of training with our staff, our teachers, paraprofessionals, and support staff to try to involve the students as much as we can. I think what's difficult is our really high-need students at home, that the parents need to sit with them just to access any type of online learning. I had a parent call CPAC meeting last night. A few of the parents were very concerned that they're like, we don't know what else to do. They're asking about when can the kids come back. And my response was really to look at the data as we talked about tonight. I mean, I'm trying to think outside the box. My team, we're thinking out different things we can do for families. I'm working with the Boys and Girls Club. We have about 110 Brockton students there. We're trying to support as many students over there as we can. I'm trying to, see if I can get some seats at the Boys and Girls Club for our students who are struggling at home. I think the majority of students are accessing, they're going online, they're working closely with their teachers, and they're engaging. But the students that the Department of Ed wants us to bring back are the ones who are struggling. Our life skills population, those kids are really struggling. We're modifying schedules for families. We're looking at the schedule and saying, maybe they do 2 hours of online, we break it up through the day. And parents are very open to that. But what they're struggling with is but for the 2 hours, who's going to be with my child? So we're really trying to think outside the box of some solutions. And that's difficult because I'm not sending people into the homes. We're not doing that right now. They're not coming into school. So I'm feel for the parents, and I'm trying to support them in every way I can. But on the positive piece of this, we have more kids engaged. Teachers are finding that, we have kindergarten kids in our self-contained classes, 5 years old, who are logging on with parent support, and they're staying on throughout the day. So those are some positives. We're providing learning bags for our students, and in the learning bags are going to be tools that the students need at home, sensory tools, academic materials. We had a couple of teachers put together writing folders for the kids, and we're having parents come and pick them up. So that's been going really well. We're having the trainings, I think, for our teachers. Having the Monday afternoon to provide PD for our teachers has been very, very beneficial because we're providing online platforms. We want to make sure the teachers are experts so they can do that. We're providing parent trainings. we did a training last night on how to survive the remote learning world. We'll be posting that for our families. Tonight was how to set clear expectations and rules and expectations for students. And the turnout has been very, very low. I think parents are tired. They're working all day with their students. They're trying to hold down a job while at home, and then I'm asking them to come to trainings at 6:30 at night. So we're going to post those for the parents. We're going to send them home to the teachers and have them send home the training. They're narrated. My behavior team put together the training. So I think that's, we're heading in the right direction there. Does anyone have any questions?
Anybody?
I have a question. You know how you mentioned that the Boys and Girls Club, you're looking for seats there? Aren't those seats $30 a week about? If a family's not
Yes,
able to pay that, how would we support them
No.
financially?
So when I say that,
Yeah.
so we're providing support as far as I'm going to have my behavior team do trainings. We're going to look at the needs of the students. So right now, I met with the Boys and Girls Club director. I don't know the students who's on IEPs. That information hasn't been shared with me because that needs to be through parent release. When I say I'm trying to get a seat, I really don't mean I'm trying to get seats because I would have to fund it. I'm just trying to figure out how I can help families who are home struggling, work with the Boys and Girls Club, and maybe they reach out to some of our families. But we're going to support the kids through my behavior team doing trainings there. She's a brand new director, Amanda Rusconi. We met with her a couple of times, and she said that some of the kids do really well there, but they're in pods of 10 kids in these little areas all day long, 9 to 3. So we're thinking about doing trainings on telling the kids how to wear masks. Exactly what Dr. Herman was talking about. Social distancing. What does it mean? Why is it important? Because those kids are actually there, and there's about 110 Brockton students attending those pods, those learning pods. I know we have to pay for them. I know parents have to pay for them, but, I'm always trying to think outside the box.
So I guess my next question is a wonder. Is there a possibility to do learning pods similar to Boys and Girls Club where we can provide a space for specifically the life skills population that really need it at this point? Is that even a possibility at this point?
Well, I think if we're talking about learning pods that the school district looks at, then we should be talking about bringing the kids back in, and we're not there yet.
Okay.
So I feel like at this point, the district, looking at the numbers tonight, I was a little surprised myself. I look at the dashboard every day, and I'm like, 25, 30. I was like excited that we only had 7 cases today, and that's pretty sad that I'm like, only 7. But to look at the number that we went from 14.7 almost to 20.2, that's a lot. And I think that hearing what Dr. Herman said kind of is resonating with me, like we need to make sure everyone's safe. So to be opening a learning pod would be the same thing as bringing kids back into school, is what I think. And I think we're not ready for that yet. We're not there, unfortunately. And last night on my call, the parents I said, I don't have an answer to some of the questions the parents are posing to me because I don't have their kids in front of me. Does that make sense?
Yeah, it does. So then you talked about the interactive programs, right?
Yes.
And that's something that you were very prideful when you
Yes.
talked about a while ago. How has that been going? Because it sounds like students can't do it without the support of their parents. Have there been students that might be able to do it without their
Yes,
parents?
so many of our students in our substantially separate programs are accessing the online learning programs. One of the programs we've been very successful with is called Boom Learning. So that we use district-wide. We're using that with our students with disabilities. We're using that, our school adjustment council using that program. Our bilingual students are going to be using that program. And it's very interactive, and it's teacher interactive, and we do have a lot of our students with disabilities are accessing that platform, which has been great. We also use, there's multiple other platforms that kids are able to engage on. I think it's the students that really, there are really high need, our life skills population is who I'm really concerned with. Now, in those classrooms, we do have kids that can access the online learning for small periods of time, but there are students who really need an adult support sitting with them. And those are the parents I'm trying to think about outside the box and try to brainstorm with my team of how we can support them in different ways.
Okay. Thank you.
But the online learning programs have been very, very successful. And I think the parents like that teacher-directed. They're in live lessons with their kids, and they may be, off to the side, but their kids are engaged in lessons, and the teachers are, presenting, a math lesson or a science lesson or whatever. And the kids are interacting because they actually are able to see their teacher.
Okay.
Also, again, I do think, as we have been doing, is talking about bringing especially students with disability and high need students back. And you can do that when you're in the red, but not when the red is going up. It's really difficult with the numbers going where they are. I think if by the grace of God, at some point we start to decline and head back towards 8, and that state would really want you to consider bringing your high-need students back, but it'd be very difficult at this time around safety and security to bring students back when you're going in the wrong direction. It's just tough. It's not a good situation, and the numbers that were shown tonight they're concerning.
Some of the families want their children back in school, but they're very, very nervous. So they say, well, right now, if you said to me, Laurie, they're coming back next week, I'm going to say no. But if the numbers go down and then I feel more comfortable, then we may do that. I mean, we still have our hybrid model plan for our students with disabilities in place, ready to go. We've grouped the students. We've cross-referenced siblings to make sure that siblings are all going to go to school on the same days. They'd attend 2 days a week to start. And increasing those days. We're looking at the transportation. I've provided the principals with data and information. More parents, we're looking at the transportation piece. Most parents, a lot of parents would say, I would want to drive my child instead of taking the van. So we have all that in the queue, like it's ready to go. But until, the next step is, okay, we're going to plan for the students to come back, then we move it up to the next step of, then really reaching out to the parents to say, do you want your children to come on, these days that we've determined.
Can I ask, I'm just curious, the Boys and Girls Clubs have the learning pods. How, is there a reason that they're able to do that and we're not able to?
I have no idea. I know that the Y and the Boys and Girls Club, and they're in, I don't know why.
They do fall under daycare.
Because
I
it's,
also think it has to do with their numbers. I think if you look at how many students are actually going to the Boys and Girls Club, it's probably maybe just over 100.
Okay.
Where the George School, if you do a hybrid model, that's 500 students coming in.
Okay.
The Brookfield, it'd be, 350 students coming in. Brockton High would be 2,100. So I think that plays a big factor in it as well, is that they are limited. The daycare centers are limited to how many seats they can give. So, I don't want to, misrepresent how many students, they have there, but I'm sure they're limited on the number. And my guess would maybe be 100 or a little bit above that. Again, I'm just totally making a guess, and I could be wrong, but that's a big difference between that
About
many
100 kids,
people
yeah.
in one area rather than, like an example, like the Davis School would have 550 kids. That's half their population, and it's just a big difference in how many people are together inside in one spot.
I just thought maybe
No, it's a good
people
point.
at home might be curious.
so yeah,
as
you
to
would ask
how
that,
come
yeah.
they can do it and right.
And the
Exactly.
kids are there
Rules.
starting at 7:30 in the morning till 4 or 5 o'clock at night. So there's only a portion of the day that's the academic piece. The rest of the time it is a smaller number.
Right. Makes sense.
They just reached out and asked for some support, and we figured, we'll go through the beginning.
And I want to thank our tech center, special education, the Office of Teaching and Learning, and some of our teachers have been assisting the daycare centers. We have set up a system in place that assists the daycare centers, the Y, the Boys and Girls Club, with the resources we have, helping them with technology, helping them with issues they're having with technology, helping them through Schoology and Microsoft Teams. So we have spent time with the leaders of daycare centers and the Boys and Girls Club and the Y, working directly with them to provide them support, because we know they have our kids there.
Right.
And it's important that we support them with any struggles they're having.
Excellent. It's good to hear that we have that relationship and that partnership going. Any other on this item? Comment, question, Mr. Sullivan?
Just a comment, Lori. Dr. Herman's probably got a real hard job in front of him, and the mayor has one too, but yours is up there as well. It's probably one of the toughest jobs in Brockton. I just wanted to congratulate you. And
Oh, thank you.
the question I had is there any special needs kids that are in school now? I mean, transport out of town to it?
So we do have students in out-of-district placements, and we do have a majority of them, students are attending. However, like one of our out-of-district placements is just closed now because of COVID, and they're closed until, they did 2 days, then they did 2 weeks, now they're closed till mid-November. So those students would not attend. And there are hybrid models, some of the programs, and parents are opting to have their students remote. So if a child is in an out-of-district placement, they have an option if the school is open to come in person, to be hybrid, or to be remote. And some of our families have chose remote, even though, even in the
They can
out-of-district
go.
school, yeah.
They're
Yep.
staying home anyway.
Yep, and, but they're facing some of the same issues. Like one of the schools just closed, so they're now closed till mid-November because they have multiple cases of COVID. And they don't want to take the chance of anybody else getting it, so.
Okay, thank you.
All right, thanks.
Okay, anybody else on this item? All right, seeing no one, thank you very much for your time this evening.
Sharon, I'm just going to leave this right here for you.
Thank you.
Was Sharon, no.
You good, Sharon?
Oh, okay, I thought she said you were gonna, okay. All right, so I think we can move on to item number 4, automatic failure.
So I just wanted to bring this to the school committee's attention. As you know, in our handbook, which is school committee policy, there is an automatic failure policy that states if a student is absent, and it's a high school policy, students that are absent on the 4th day would fail the class. We are relaxing that, obviously, in these circumstances. It doesn't mean we're going to pass students if they don't do any work. It just means if students had trouble logging on, engaging, different things that are going on, obviously, during a pandemic. This also could happen at middle school, but it's more, it doesn't have a hard number for absences at middle schools. If there's an excessive absences, and, then they could be automatically failed. But we are going to relax that, especially for term 1. And we'll get the word out, and I know the high school has talked about it. The alternative schools have talked about it, and it's just, again, it doesn't mean students will pass. They still have to engage. They still have to complete the work that the teachers and get graded on that work. So they have to earn the grade that they'll receive. But we are going to take the option of an automatic failure out in light of these circumstances.
So how would it just be left to the individual teacher or the school administration to kind of
Well,
make the decision?
So the way the automatic failure works, it could be a student that, say they're getting a 75 and they end up being absent, 6 times in a term, and if they don't have doctor's notes or notes to excuse those, or they can get a waiver for those, then they would fail with a 59. So if they say they had a 75, then they would fail with a 59. That's the regular in-school policy. And that's in place because, MCAS does make, you need to be in school at least, 90 to 90, I think it's 97% of the day. So that's why, that policy's in place. But again, in light of this, we're going to relax that a bit, but it does still mean the student has to do the work.
Right.
So it's, if your actual work product produces a failing grade, then you will be getting a failing grade. It won't be because
Right.
you were absent too many times.
Right, gotcha. So if you've
Yep.
got the 75, like your example, And the only issue is your absences, you're gonna keep
You're
your
going to get
75.
that 75, correct.
Right, okay.
I was just using 75 because that's,
Well, yeah.
I think those are mostly the grades that I got when I was in school,
You and me both.
right around the,
You and me both. I think my parents would have celebrated
right
a
in the middle
75.
of the bell curve there.
Anybody else want to weigh in on this, other members?
Should there be a vote on that, or?
Would we need a vote on that, I
I
think?
think it'd be good to take a vote, just because
Yeah,
it is in
'cause
the
it
handbook.
is in the handbook?
Yep.
Okay. All right, so, does anybody want to?
I'll make the motion if you like.
Okay.
A motion is to relax the automatic failure policy in the handbook.
Second.
We have a motion by Mr. Sullivan, properly seconded by Ms. Asak. Do we have any further discussion on the motion? All in favor?
Aye.
Oh, I'm sorry. Can you turn your mic on? I can't hear you.
Sorry, Mr. Vice Chair. Should we be a little more specific in terms of just relaxing the policy? I mean, do you think that there needs to be a little more specificity with regard to
So
the...
basically, that we will not be using automatic failure as determining a student's grade for the term one.
And that there'll be other factors? I mean, should we...
Yeah, that would be directly related to the teacher grading them on their work product, on their participation.
I just think that language needs to be in this motion.
Yep.
Right, Mr.
That's all.
Sullivan, maybe want to, well, actually, I think, would Ms. Asak have to revoke her second, and then Mr. Sullivan could amend the motion?
Yep.
I revoke my second.
And I'll amend the motion. The motion is on the automatic failure to revise it, instead of saying relaxing, that the grade still would be counted, and absenteeism was not part of it.
Yes, correct. That's, yep.
Right, so we're saying...
That's the motion.
As absenteeism is not a part of the
Yeah,
grade.
automatic failure.
Okay. All right. Is that better? A little more specific?
I just think you should list some of the criteria that are going to be, is going to be replacing the automatic...
Well, I don't think there's anything replacing it. It's just basically it would be the teacher giving the grade the student earned.
Right.
Okay.
So the way, so if I earned an 80, but, you know, if this was normal times and I was absent 4 times at Brockton High in that term, and I didn't have any waivers or doctor's notes, then I would be getting a 59. I would fail through the automatic waiver. So now we're just, I mean, the automatic failure policy. So now what we're doing is saying that we're not going to use automatic failure for a reason, for a way to fail a student. Basically, if a student fails, it's going to be because they didn't do the work, and they just, you know,
Right.
and it's just their grade wasn't good enough to earn anything higher than an F. So it's going to be based on that, and not a student failing. Again, a student could fail because they're just absent too much, and that means they're not doing their classwork. They're not
Getting the
They're
assignments.
not getting the assignments. They're not learning what they need to learn to pass a quiz or a test, and they're going to be graded on their product and not on if they were absent too many times.
Okay.
So I don't know how we
So
want to wrap
perhaps
that
maybe
into
we
it.
can word it, I mean, it's up to you, Mr. Sullivan, it's your motion, as we are going to, do we want to put a time frame on it? That's the other question, is do we want to put a time frame on it, term 1 and 2, and then we'll revisit it? You know, so maybe say we're going to suspend the automatic failure policy for terms 1 and 2 to be revisited.
I'd like to change my motion if I could.
Please do.
Because it is, if you say you're suspending the policy, it is laid out in the handbook.
Right.
All the ways you automatically fail, those details are in the handbook.
Right, and so we'd be suspending that whole piece
That
of the
full piece.
handbook for term 1 and 2 only, and then obviously we can, in a future policy subcommittee meeting, make a decision about 3 and 4. Wow, maybe I need to take a math class.
Do we want to identify the piece in the hand? I'm not trying to be difficult. I think that if there's a situation where a parent is going to make an argument that you're not following this, you're not following that, and we're basing it on a vote that we took tonight, all I'm saying is to assist the administration, the teacher, the school system, that I think we should identify the section of the policy, properly identify it within the handbook.
Yep.
We have that
And then
handy
we,
to-
basically say that, the factor with regard to chronic absenteeism, which currently in this handbook is listed as 4, is hereby suspended for an approximate period of, 2 terms, whatever you determine or we determine is good, and other factors such as, teachers, students, grades, students' participation, students, attendance, just list it all out, just specify it, these are the factors, but other factors may be considered. I mean, I'm all for it. I'm just saying, I just want to get it right. I just don't want to create a problem for people later on that
Right.
someone's going to say, hey,
Well, do we happen to have anybody that knows what section of the handbook this is in?
Chairman, my humble suggestion under Robert's rules, we're in a subcommittee meeting.
Yeah.
Take a motion to send it back to full committee, that there's going to be a modification. It'll give us time to next week. We can do it on the floor, make an amendment
I'll
on the
send it
floor on the full
Friday.
council. So you want to make a reference to the actual section of the handbook.
Right.
But tonight in the subcommittee, we should make a favorable recommendation of a modification back to the full committee and then amendment on the floor.
Yeah,
Right.
it is clearly labeled in the handbook as the automatic failure policy, so.
Yeah.
But I
Whatever
will
section
I will
that
get the
is, and-
section
yeah.
and I'll
I
get
think-
that to you Friday.
The mayor's suggestion is fair. We need to move this forward. I appreciate the point Mr.
No, I
Minichiello is
agree with
making,
Tom,
and I
but because we
agree.
don't know the section,
Right.
if you make it favorable, coming out of subcommittee back to the full committee, gives us time, we'll have it written out, and boom, take a full vote with as
Exactly.
amended, and it's done.
Right, and I don't want to hold this up because we don't happen to know the exact section tonight. Okay, then I don't think you need to amend the motion as stated because we're not putting the section in this evening.
No, I withdraw the motion and make a new one.
Okay,
And the motion is that we move this favorably to the full school committee, waiting further instructions from the superintendent.
No, it'd be
On the
further-
section.
It'd be the section of
The
the.
policy.
handbook.
right, okay. Is that? Okay. All right, so we have a motion on the table. Do we have a second?
Second.
All right, properly seconded by Ms. Azak. Do we have any further discussion on the motion as presented?
Just on the motion, just so everyone's clear, because this is a matter of record. Well, Mr. Sullivan is making an amendment, seconded by Ms. Azak, to go back to the full committee, and it's to modify the automatic failure section of the handbook. And then next week, we'll have that section. It will
With the
detail
number.
what Attorney Minichiello said, and then it gets incorporated therein.
Okay. All right. Okay, so any other discussion on the motion? All right. All in favor?
Aye.
Aye. Okay, thank you.
And I just wanted to give you an update on attendance for any extracurricular activities. So we'll be starting some clubs, virtually clubs, and obviously now we have the fall sports, which will be ending in 2 weeks. There's only 2 weeks left. But there were some questions about attendance for extracurricular activities that includes anything to do with sports and clubs. Students do need to be in school. It's the regular attendance policy as far as you need to be in school that day, even though remote. You need to be considered in school for at least a half day. So if you had a doctor's appointment and you were excused for the second half of the day, but that means you're present. So you either have to be in school for a full day or half a day with an excuse that you couldn't be there for the second half to be able to participate in extracurricular activities. So that policy stays the same, because there's been some questions. I just wanted to make that clear to everybody, that you do need to be present, marked present in school to participate in any virtual clubs, anything that's going on that are extracurricular activities
Right, that day.
that day.
But
Correct.
we had, in that, this is the next item, is to talk about the citizenship grade, or, because that kind of coincides with, I know there were certain activities that if your citizenship grade is below, and I don't remember the exact way it's in the handbook, because I know it's been changed
Yep.
a few years back. You're excluded from certain activities if you don't hit a minimum citizenship grade, and attendance is part of that, so
No, attendance, it doesn't play into.
Take that out completely?
Yeah, attendance doesn't play into a citizenship game. It's grade, it's simply behavior.
Okay.
And we changed that in the handbook a few years ago to allow the assistant principals, deans, assistant deans, much more discretion to
Okay.
work with a student, so we weren't taking things away that, for a student that,
Right.
unless
There
it was an egregious act of one of the three major, drugs, weapons, or violence. Unless it one of the three big ones, we call them, then, the other things, we would use our discretion for other disciplinary matters.
Okay. All right, I didn't remember the exact way that we had changed it. I knew
Yep,
it had
that's
come up a
exactly
few
how
years
we-
ago and we had
yep.
changed it. All right, so we probably don't need to do anything more with that other than just, I'm fine with that then. All right, item 5, does anybody have any comment? All right, seeing none. Item number 6, student laptop cameras.
So, as you know, we have students turn their cameras on for attendance. We talked about this when we were doing our amendment to the handbook. So we do have students that, their cameras have to be on during attendance at the beginning, at the end of class. We are going to be working with our schools to make sure that students are following that policy, and parents as well. And the reason I brought this discussion up, and we had it at the executive team this past, it was actually yesterday, is the tragic and horrible story out of Fall River for the 14-year-old special needs student who was so neglected and so mistreated. It's despicable, the story, and I saw it. I spoke to the superintendent in Fall River, and it just made me think about the importance of us being able to lay eyes in this remote setting on our students to see if they're in distress or if they're being mistreated, because, again, that story makes you sick to your stomach. And I just want to make sure that, and teachers are looking for these things. They're working closely with their students, but we really want to make sure to support the teachers to make sure those cameras are on, especially during the attendance time. And we are working on a way to make sure we can set backgrounds, because, again, the biggest issue we had was making sure that, we didn't put students in a situation if they were in a home life that was difficult, and, we wanted to take away bullying and those kind of things. So, to set backgrounds, to automatic backgrounds, so you don't see things going on in the home as far as behind, but you're able to see the child to make sure teachers can identify anything that's going on, to make sure that we're able to contact DCF with a 51A or have the school police do a wellness check. And again, reading that story, that horrible story in Fall River, I just wanted to make sure I brought that up for discussion tonight. But we will be working, with our schools to make sure that policy in the beginning and end of the class is put in place to make sure that we are seeing our kids, because they're not allowed to come to school. And like usually when we report to DCF, student comes to school, they report something bad has happened, we file, we have the police do a wellness check, and it's very difficult now in the remote setting, but we still have to keep it in the forefront and make sure we're protecting our students.
Right. So we would basically, at the beginning and end,
That's what the-
require everybody to turn their
Yeah,
camera
and
on.
that's what is in the COVID addendum to the handbook, that when they're taking attendance, and attendance in the beginning of class and attendance at the end of class, and teachers are doing a good job. They're actually encouraging students. A lot of students will keep their cameras on, but it's important to make sure we have that beginning of class and end of class check-in. So we're laying our eyes on the student to make sure everything's fine.
Okay. All right, so do you need us?
No, I
to
don't,
take
just
any-
wanted to make sure I brought that up and
Okay.
had the
I
discussion.
didn't know if you needed any
Because I know
action
it's
from the
been,
committee.
there's been a lot of talk about that among superintendents, about that, again, that story hit everybody hard, so.
Right, okay, great. Any comment on that item? All right, final item is other business. Is there any other business, Mr. Mayor?
Mr. Vice Chairman, I just want to give the members of the school committee an update on the CARES Act funding. I had a call today with County Treasurer Tom O'Brien, County Commissioner Chair Dan Pilata, and Troy Clarkson, CFO of the City of Brockton. Since September, the city/school, but it's coming out of the city, have submitted $9.6 million for reimbursement under the CARES Act. Again, the county is controlling the CARES funds. We have been told as of today that the $7 million submitted on the school side for the laptops, now we're a one-to-one school district, and Dr. Cobbs is nodding because he spent hours and hours working on it. We will be getting a full reimbursement on that. The projected date of the awarding of the check ceremony, and all of you will be invited, is the 12th of November, November 12th, which is a Thursday. Wednesday is the holiday, and then Thursday. So Danielle in my office will let all of you know. I suspect it'll be a noontime ceremony, but that's great news. $7 million will be coming back. And we are, if there's a silver lining in COVID, I would say there's not, but if there is, it's now that we're a one-to-one school district, and we never thought we would be. So thank you to Aldo Petronio, Troy Clarkson, and of course Mike Thomas, Dr. Cobbs, for working diligently to submit that. So that's the good news.
Great. Any other business for the policy subcommittee meeting? Mr. Superintendent.
I just wanted to let the school committee know that on Wednesday, the 4th of November, I am going to allow staff to work remotely that day. It is the day after. We are off next Tuesday, the 3rd. And with 13 of our schools being used as polling locations, I'm going to use that Wednesday for deep cleaning. Even with the schools that don't have, those teachers would and staff would be allowed to work from home. They would have the option if they want, not the schools that have polling, you know, everybody's going to stay out of those schools except for, you know, that custodians will be deep cleaning and using the electrostatic spray guns. But, you know, if teachers, like at Brockton High, which is not a polling place, if staff wanted to come in and work that day, they could. If they didn't want to, they could stay home and work because it's got to be fair across the district. But I'm going to use next Wednesday, the 3rd, the day after. Again, we're off on. There's no school on the 3rd. There's no school. Election day, Tuesday, and then the 4th will be a remote day for all staff. And except for custodians, obviously, who'll be deep cleaning. And then the schools that are not used for polling places, those teachers and staff would have the option to come in or the option to work from home that day. I just wanted to make sure I let the school committee know that so we could spend that day deep cleaning the schools that were used for polling. Because I think it's going to be obviously a very big turnout. And so we just want to make sure we clean and disinfect with so many people coming in and out of the buildings.
That absolutely makes sense. Ms. Asak?
I just had a quick question, and I just realized this. So how are we handling the food distribution at the polling locations, the schools that are polling locations? Because, I mean, that's from 3 to 6, and that's probably going to be the busiest time for a lot of voters that are coming out on Tuesday. So how are we going to handle that?
I'm going to talk. Actually, it's a good point because I didn't think about that.
Because I know
So,
Brookfield
Dr. Cobbs,
is pretty busy.
can you talk to Aldo and Tom Burke tomorrow, and maybe they can double up the meals for Monday, and that way, you know, they wouldn't have to use Tuesday, or we could just say to the parents that on that Tuesday, the only locations will be the schools that we use for. So we'll get them. That's the best way, rather than not to have a meal. What we'll do is we'll just say, put word out that at tonight 3 to 6 you can only get your lunch or dinner at the locations that are open that do not have polling. So that's a good point. So we'll get the
Okay.
word out for that.
Do we know how many of those schools are affected by that?
Well,
I mean,
you
I know-
have Brookfield will be, Gilmore, South, East, West,
Hancock,
Hancock,
Kennedy.
Kennedy, Davis, and the Barrett Russell,
So that's a lot of our schools.
and Downey,
In the
Yeah.
Raymond.
and the Raymond too.
And North.
And,
And
yeah,
North.
North is used as well. The 13, so 13 of them. So we'll have to it might be easier to double up
Do it for Monday and then
on Monday and then come back full.
have
you know,
calls
for
go out
Wednesday.
just to
That's
remind
probably-
parents.
As the traffic is going to be.
Yeah, we'll do a robocall on that. Yeah.
Oh, absolutely. Do a couple. Yep.
And we're always going to have stragglers here and there, so maybe just have one location that we
Yeah,
have
I
a little
can say that
extra.
maybe we can just keep it here at Brockton High. Yeah, that way we can have Brockton High. We'll keep, I think we should, I'll find a school in each part of the city
Okay,
where we could use, it would be tough to get anything, so Brockton High would have to be used for this side of the city. And I'll just have to, like the Baker can still run. for for the east side of the city, the George, we
Plouffe.
can still run, the Angelo, the Plouffe can still, so we can still run it at those
Okay.
schools and just let people know.
Perfect.
And we can still double up on Monday in case people can't go to those places. We can still give them an extra lunch for Tuesday, for Wednesday, I mean.
Because
so we
I
can-
do know, like, I've gone a few times to help some of the constituents out, and it takes a little longer because you have to get out of the car, go get it
Yeah.
from the table. So there's a line, so I can't imagine that and have the voting going on at the same time. It's just gonna be a
That's
little
a good
messy.
point. Jim will work with Aldo and Tom Burke tomorrow.
Okay.
So we'll keep it open for the non-polling schools, and then we'll also ask if we can double up on Monday night.
Is there a way we can put like a slip of paper or something in their bags?
We can.
For
print
Friday,
out-
just to remind them, and then on Monday, just to remind them, there's, if you want to go to these locations, and
Yeah,
it'll
we
be
can
at the
have, we can have those
locations.
printed out at Central, and we can put them all in the lunch bags for Friday and Monday. We can get them translated as well.
Mr. Sullivan?
Mike, I was just wondering about the deep cleaning on Wednesday. What about the grab and goes on that day?
Well, those will be that night, so they'll go in and make sure that, so that, obviously, the lunch ladies will be working as well, but they'll make sure that the kitchens in that area they're working will be done Tuesday night, because the custodians will be there.
Okay.
Late, so the schools that have, that are doing the grab and go, the custodians will be staying later on Tuesday night and make sure they get all those areas.
Okay, thank you.
And then
Vice-
on Wednesday, they'll do the rest of the schools.
Mr. Vice Chair.
Yes, sir.
I just want to give some information. As it was stated, Tuesday's Election Day. Couple pieces of information. The indoor, I voted today. I was in and out in 5 minutes at the Westgate Mall. It starts at 8:30. It ends this Friday. It's inside the back of the mall. You go in the Joanne Fabrics entrance, and you walk in. It's the former Payless Shoe. It's clean, it's sanitary, it's done the right way, literally in and out. So if you can vote before next Tuesday and you want to go to the mall, it stops this Friday. If you want to drop your ballot box into the drop box, it's at City Hall. We all saw what happened in Boston, right, when that fool put one on fire. We have Brockton Police this coming weekend. They're going to be there 24/7. A cruiser will be there at City Hall. But during this week, it's picked up hour on the hour, so if you want to drop it in the drop box, rest assured it will be safe. In terms of Election Day, some people are concerned about going to the polls. If you choose to go to the polls, it's going to be like any other time you go to the polls, except it's going to be a longer wait. There's police officers there. It's going to be sanitary. It's going to be safe. I know Cynthia had reached out to me in the primary because West Elm Street had been blocked. West Elm Street is open now. War Memorial and Goddard Road, those polling locations are good to go. So I just want to urge everybody that if you're going to vote, please do your duty and feel safe from a COVID standpoint and a public safety standpoint that we're dotting the i's and crossing the t's. Thank you, Mr. Chairman.
No problem. And I would only add to that, please wear your mask to the polling locations. Let's not have the polling locations become a part of the problem. So please, bring your mask. All right, if there's no other business if there's nothing else under other business for this subcommittee, then I'll entertain a motion to adjourn.
Motion to adjourn.
Do we have a second?
Second.
All right, all in favor? We are adjourned.